Hi, my name is Miranda Olivares, and I want to talk to you today about sudden infant death syndrome, also known as SIDS. It can also be referred to as cot death or crib death. Sudden infant death syndrome is a sudden death in infants that is not predicted medically or diagnosed upon autopsy after death. SIDS is at its highest risk for infants under the age of 1 year old. There's really no sign of suffering. The cause is still unknown. SIDS is the third leading cause of death in infants to this day, but since 2011, it has been declining since its first reveal in 1988. Because the cause is unknown, there are many preventions that and strategies that we can consider when putting your child to sleep. For instance, be sure to lay your child on their back. Because of gastrointestinal problems or reflux, if you put them on their sides or stomach, it puts pressure on their jaw, causing suffocation. You want to make sure that they can breathe clear when they're on their backs opposed to rolling over on their face. Babies are not quick in response when laying on their stomach and laying flat on their face to move around for that fresh air. You don't want them breathing the warm, hot air of their own. Laying them on their back will assist in that. The surface is soft. Baby's nose can sink into, and they are unable to breathe clear air. We also want to remember that placing your child on their stomach increases their risk SIDS 5 times. Again, placing your child on their stomachs increases the risk of SIDS 5 times. Bedding is so important when it comes to infants. We want to remember that when you're putting your child to sleep, you use a hard, a stiff surface opposed to something soft or snuggly that we would normally use. It's not safe. Product safety experts um, have been against using pillows, soft mattress, sleep positioners, stuffed animals, blankets, anything in the crib that can cause suffocation for your child. You want to make sure that you use something firm when laying them in the crib. No soft, tender sink type mattresses for your babies. Although positioners are really good, they're not the best because it doesn't give the child the opportunity to move around, and it keeps them in a position that they shouldn't be in. Breastfeeding is also known to play a key role in preventing SIDS. Most women can breastfeed. Some women have trouble breastfeeding, or some women just don't want to, have no desire to breastfeed. But breastfeeding has been known to play a role in prevention of SIDS. It does decrease their risk of gastrointestinal diseases that can result in reflux and aspiration or suffocation of your child. I didn't know this, but your mother's milk or your child's mother's milk is can be emptied faster than a formula. Formula is more thicker and it's more solid. Breastfeeding also serves as a calming effect on the baby. It helps organize the baby's sleep and wakening cycles. They can sleep better when they're breastfed. And we always want to remind our parents to educate everyone watching or around the baby that's holding the baby, to let them know so that they're aware of these preventions that can be a fatal effect to your child. Again, always use a firm mattress, no blankets, no stuffed animals, no pillows. Lay the baby on their backs. And if you can't breastfeed, breastfeed is the number one choice. Thank you.